for a very lucid information about this. For the interest of audience, I don't think we have any other speaker here. We can have some discussion and talk. And for the interest of the audience, we all know TAVi, which is TAVi, transcatheter aortic valve implantation, first done by Dr. Alan Crevier in 2002, 16th April. And I had the privilege of working with him before that when the animal experimentation planning was being done. Now it has become almost a normal or routine, not routine procedure, but at least for big centers they are doing regularly. And Dr. Bali, you have done you were talking about the very specific talk about the prosthetic patient mismatch. I was initial 3-4 slides I missed out, but the interest of the audience again that this mismatch can be really catastrophic and it should be really immediately diagnosed as soon as you have done it. You have said that problem fracture, well fracture can be a good technology, but I was talking about and thinking in my mind that this is more common in the self-expanding valve as compared to balloon expanding valve, or it is equally common in both the cases. Then we can have more discussion.
It's equally common, it is less common in self-expanding. Expandable would be manual valve. So suprarenal would have a little less because the SOBs are going to be a little roomy, and this is suprarenal valve. The problem I want to make is that it is actually at the time when surgery is done that we should be implanting a larger valve. And there has been problem when the valve implanted at the time of surgery is smaller, and maybe 19 millimeter is going to be very small. So therefore, what we recommend these days and what most of the surgeons follow, that if the aorta is small, the aortic root is small, then it's better to dilate, have an enlargement of the aorta, surgical enlargement of the aorta at the time of surgery, so that we can implant the largest possible valve. That is one part. And second, we have one valve which I showed, which is TAVi compliant. And we are likely to get more such valves in the future. So we should be looking at a situation where we put a TAVi implant valve, because we look at lifetime management of these aortic stenosis. So it's quite likely that those who have a surgical aortic valve would in the future require.
This is which company you said TAVi compliant? Which company is it?
Edwards.
Okay, Edwards only. Just to give you a small, when you talk of Edwards, when the planning of things done, I mean, away from your topic, just for the interest of the audience, we have time. When Dr. Alan Crevier, I had a talk yesterday, was planning to have a company to support his idea, and when they had no prototype was made, one human prototype in the cadaver. So the same company, Edwards and Medtronic, refused the idea, and now they're selling it like hotcakes. So